السلام عليكم. كيفكم يا جماعة؟ أنا معاكم، أنا إيمان حيدر، أنا GP-ST2 trainee in South Yorkshire Barnsley scheme. أنا الليلة دايرة أقدم لكم just GMC registration updates or kind of refreshment كده عن ال GMC registration pathway. اللي حصل شنو والما حصل شنو والجديد شنو with regards to GMC registration. I'll give people a couple of minutes given to join. ما تنسوا تكومنت بالquestions عشان أنا في نفس الوقت حكون بشوف questions. I'll try to answer as I go on. أو ممكن نخلي questions للنهاية، لكن if there is any related question I will answer them. أهلا يا يسري، كيفك؟ الناس دفعتي طبعا، إن شاء الله كلهم يسهروا الليلة. صوت من المايك يعني في وشوشة كده، أطلعه أغيره؟ طيب دقيقة، لو طلعته هو مكسور شوية لكن كده نجرب. كده سامعيني ستيل ولا ما في صوت؟ سامعيني يا جماعة؟ كده سامعيني من غير المايك؟ still noise؟ اوكي كده احسن، تمام. طيب ماشي، هعيد تاني. أنا إيمان حيدر، أنا GP-ST2 trainee South Yorkshire في بارنسلي في UK. So I'm presenting GMC registration updates الليلة، بس chat كده نشوف الحاصل شنو، الجديد شنو مع الكوفيد مع everything. Just kind of a refreshment video. تمام، ممتاز ممتاز، الصوت واضح. تمام. اوكي طيب أنا عندي presentation. I'll share it now. نبدأ به، وأي أسئلة just feel free to put your questions in. We'll answer them as we go on. Okay? طيب تمام. ممتاز، بس في شوية خربطة في هنا. تمام كده الصفحة الأولى من البرزنتيشن واضحة لكم، اللي هي GMC registration. افتكر تكون واضحة. تمام. أهلا يا مودة، كيفك؟ طيب يا جماعة، بالنسبة لل GMC registration اللي هي نحن هنتكلم الليلة عن ال GMC registration pathways، ال English requirements، ال BLAB mainly وال other routes for GMC registration. أي updates، أي حاجة جديدة we'll talk about it today. So let's start. As usual, when we talk about GMC registration, English language requirement first. So English language requirement first. قبل أي شيء، قبل we touch anything about the GMC registration, the road to UK, it's English always. طيب بالنسبة للإنجليش language requirements، ده اللي هو الثابت دائما، اللي هو الIELTS academic version overall 7.5 and minimum 7 in each module. اللي هو الIELTS exam, it's an English language exam. فيه listening، فيه 4 parts: listening, reading, writing and speaking. المطلوب منك for the GMC registration process إنه يكون minimum 7 in each module والoverall score يكون 7.5. So this ما تغير أصلاً، يعني هو من زمان ما تغير. الزاد جديد لكنه يعني له فترة، الكلام ده ما جديد شديد، اللي هو ال OET بقى acceptable. ال OET scores تكون no lower than B in each of the 4 areas. فبقى acceptable language English language exam for the GMC. والنقطة الأخيرة، لأنه في ناس شنو زي كلنا حصل، يعني أنا برضو حصل لي in the past when I was struggling with IELTS كده، اللي هو مثلا بتجيب السكور المطلوب اللي هو 7.5 7 in some of the modules، وموديول مثلا تقع فيه ب 6.5 or something. إنه هل ممكن أنا أستخدم 2 tests for example؟ أنا في التست الفات جبت في الرايتنج 7، لكن في التست ده جبت 7 رايت 7 بس جبت 6.5. Can I use the previous one وكده؟ No. So all the scores has to be achieved in the same setting, either for OET ولا IELTS. It has to be achieved in the same setting. Okay. شايفة في ميول كتير من الناس إنه يمشوا towards the OET exam. It might be a bit easier because it's medically oriented English language test rather than an IELTS exam اللي هو general. So I think most of the doctors now are going to the OET exams. Okay. طيب let's check so far. في أي أسئلة؟ Lovely. Okay. تمام. في دي أنا الحتة دي كنت ما أقدر أخدها، لكن it's there so I'll put it. اللي هي إنه يكون عندك medical qualification that has been taught and examined in English. كويس؟ نحن في السودان ما كلنا have been taught and examined in English في الجامعات، لكن هل ده معناته it's acceptable for the GMC؟ No. So الرول دي mainly للناس اللي قالوا بالإنجليزي في جامعات إنجليزية، لكن mainly for specific countries اللي هي الإنجليش is their first and native language. الGMC ويب سايت عندهم يعني list كاملة بالكونتريز اللي هي بيقبلوا منها ال primary medical qualification being taught in English. فدي بتعفيك من ال English test exam. لكن بالنسبة لنا من السودان أو من أي دولة عربية أو غيره ما بينفع. We have to go through IELTS or OET first. Okay. طيب نمشي بعد ذاك للجي ام سي registration pathways اللي هي هو زي ما قلنا we have to clear the first step اللي هي الانجليش exam. you have to بنفس السكورز المطلوبة وتكون within 2 years. نتكلم بعدين كده في الآخر اللي هو عن إنه في شوية كان في flexibility during الكوفيد، عملوا extension حبة up to 3 years على حسب الظروف اللي خلتهم يكنسلوا الاكزامز بتاعتك، لكن دي نتكلم عليها في النهايه كده عشان ما نلخبط الامور، نكون نسي في الواضح. بالنسبه للجي ام سي ريجستريشن باثويز اللي هو عندنا البلاب باثوي، acceptable postgraduate qualification pathway، والسبونسرشيب باثوي. اوكي طيب I'll just check إذا في أي أسئلة I can answer so far. اوكي ما شايفه في اسئله so far so that's good. طيب بالنسبه للبلاب، البلاب طبعا بنقسم ل 2 tests as everyone knows or heard about is BLAB 1 and BLAB 2. البلاب stands for شنو يعني؟ نحن طوال بنقول بلاب. What is BLAB? It's Professional Linguistic and Assessments Board. The exam has 2 components, BLAB 1 and BLAB 2. BLAB 1 written و BLAB 2 is a practical test meaning it's like an OSCE test. طيب في دائما الناس بتسمع عن انه في البلاب كله هيبقى replaced by ال UK MLA وكلام زي ده، وكان مفروض البلان انه to be replaced within these years 2022 2023. It has been postponed ل 2024. ال UK MLA ده لما نيجي هيكون for both ال UK graduates and non-EU graduates كل الناس هتمتحنوا. الفهم I don't think people should panic about it if it happens. It shouldn't be much different than BLAB. في النهاية they want to test your abilities as an F2 doctor or foundation level 2 doctors, that you are able to do the things that a foundation trainee level 2 doctor can do in UK. So it shouldn't يعني الناس ما تركز على إنه هاي الامتحان حيقلب يبقى لنا حاجة جديدة و UK MLA وما بعرف شنو، ما تركز على الحاجة دي، تركز على الباثوي اللي هم ماشيين فيه. طيب بالنسبة للبلاب، البلاب طبعا البلاب عشان تسيت البلاب first as I said first English has to be done first. بعد ذاك البلاب لو خلصت البلاب وعندكم acceptable pattern of internship واللي هي حنتكلم عنها في next slide, then you can apply for full registration. What happens is sometimes people fall through the cracks. الانترنشن بتاعهم for some reason ما بيبقى acceptable. Then بعد ذاك GMC will offer them provisional registration rather than full registration, which makes things a bit difficult. Okay. Okay, so I have a question here. So بالنسبة للvalidity of English test 2 years, yes, it is 2 years for both OET and IELTS. Can I go through it or should I do another test or just, if you pass the 2 years, إذا خلصت 2 years, إذا خلصت 2 years, ideally you should be going for another test. GMC won't register you unless you go for another test. في special circumstances that we can discuss at the end. It's a bit of a gray area to be honest at the moment. لكن حاليا GMC رجعت للمين رول بتاعتهم اللي هي إنه لازم تكون within 2 years. يعني أخذت الإنجليش خلصت الآيلتس أو OET المفروض البلاب مثلا لو أخذت البلاب 1 بلاب 2 تكون finished within these 2 years to apply for full GMC registration. الامتحان ما بس في UK لا. بلاب 1 is available overseas. متواجد في كثير من الدول overseas. If you check the GMC website you write Blab 1 بيظهر لك إنه هو وين available overseas, and it is available in UK as well. Blab 2 mainly in UK. زمان كان one test center, هسه بيجوا 2 test centers في لندن and Manchester. طيب نجي للنقطة بتاعت الانترنشيب اللي هي أنا بحسها إنها vital مهمة, اللي هي الانترنشيب بتاعكم لازم to meet specific criteria. والكرايتيريا دي أنا نقلتها لكم زي ما هي من GMC كويس, اللي هي minimum 12 month continuous medical practice. في دول الانترنشيب بتاعها أكثر من 12 months, لكن شوفوا هم دايرين شو minimum 12 months of continuous medical practice, ومشددين جدا على حتة بتاعت إنه ما يكون في عندك أي absence of more than 20 days plus an annual leave. اللي هو كجنرال rule we say nothing more than 5 weeks. كويس, إذا في أي break more than 5 weeks, okay, هنا you'll have to explain. كويس, قول مثلا for whatever reason you've been off sick for more than 5 weeks. Whatever reason, what happened, you had a break for 2 months, 3 months, whatever, during the internship. You will be asked to explain why. You might be asked for evidence. Things might get a bit complicated and things might go smoothly. So الموضوع ده في يد الأوفيسر اللي بيمسك الكيس بتاعتك تماما. No one can say والله for sure والله لو 2 months ولا 3 months بمشوك ما مشكلة. No one can say for sure والله إنه لو البريك ده you just explained it, they might not ask you for evidence, they might ask you for evidence. So it's totally case by case dependent. لكن في يعني I've got lots of good responses like from people who had breaks and they could explain them really well to the GMC, and then they got over it and they got GMC registration at the end. Okay. لكن النقطة دي مهمة بالذات للناس اللي دايرة تبدأ امتياز هسه, ركزوا في الحاجة دي. الظروف الظروف أقوى مننا, يعني في you have sometimes you have to just go off for a bit of time. لكن just make sure you can explain what if that's your aim, you are going to UK, you can explain why were you off for more than 5 weeks, that you can provide evidence as well. Okay. تمام. As I said هنا, طيب, as it's exactly said this in the GMC as well, we'll assess whether your training or experience is acceptable against the criteria in place at the time we receive your application for registration. فدي totally depend on the officer اللي بيمسك ال GMC registration application بتاعك. Okay. Any questions so far? طيب. لو أخذت, طيب أحمد عبد الله, لو أخذت بلاب 1 في 2023 هل حيكون متاح لي إنه أكمل بلاب 2 في 2024 ولا هل حأدخل في النظام الجديد UKMLA؟ طيب سؤالك ده depends totally على التواريخ اللي هم حيعملوا introduction لل UKMLA. كويس؟ If you still have time and you've got an exam booked already, then you can go for it اللي هي للبلاب 2 تمشي تمتحن البلاب 2 كده. لكن إذا التواريخ اتغيرت و they change the rule, الGMC دايما they act يعني بيكونوا قبلك هم بيفكروا في الحاجة دي. كويس؟ فإذا في أي شيء ممكن يعمل خلل في البروسيس بتاعتك they will let you know what's your options then. Okay? No one can know now. ما بنقدر to predict what will happen. لكن هي الجنرال information المكتوبة اللي هي في 2024. 200 we're not sure. Okay? طيب. I'll check if there's any more questions. طيب سمر تسأل الامتياز لو ما تعمل يعني لو ما عملت امتياز نهائي for full GMC registration you have to have an acceptable pattern of internship. في other routes I think إنه اللي هي ممكن لو أخذتي provisional registration ودخلتي البروجرام الفاونديشن بروجرام بتاع UK اللي هو foundation year 1 foundation year 2 it's competitive وبالذات للناس الانترناشونال medical graduates زينا. لكن في people has gotten into the foundation program ده ممكن في النهاية يديك إياه full GMC registration. So that's one pathway. Okay, so I'm seeing some questions. شهادة الامتياز من مصر مقبولة في الGMC؟ هل بتعادل F1 بدون مشاكل زي الامتياز في السودان؟ الانترنشيب ما شرط من country معينة. المهم إنه الانترنشيب meets the criteria بتاعت الGMC. Okay? زي ما هم كاتبين 12 months continuous medical practice. Usually it's minimum 3 months in medicine, minimum 3 months in surgery. لكن ما they're not يعني ما restricted to certain countries أو كده. Okay. محمد ممكن أجاوب على سؤالك. I think جايين forward with other postgraduate examination that you can register for GMC. With MRCPI, I'm not sure. But لكن في acceptable postgraduate qualification exams that you can go through and you can get GMC registration afterwards. ففي أنا حنجي نتكلم عنها shortly. Is there a difference regarding success rate of OET exam in UK and Arab country? No, I think it's a standardized exam. لو اتعمل هنا أو اتعمل في any other country it should be the same. يعني ده exam على مستوى يعني it should be the same everywhere. What is F1 and F2? F1 we mean by F1 is foundation year 1. F2 is foundation year 2 اللي هم الدكاترة اللي هو ده الامتياز البريطاني هنا. هو بيكون سنتين foundation year 1 trainee foundation year 2 trainee بيعملوا على سنتين. Okay, I think so. We'll go through which is better, BLAB or something else. أيوة BLAB 2 في UK. طيب بالنسبة للممبرشيب exams جايين للكلام في الممبرشيب exams. طيب أوكي نواصل ونجاوب تاني على كم أسئلة. أوكي طيب this is a statement about BLAB exams. BLAB is a manageable exam if you prepare for it well. أنا شايفة إنه BLAB is one of the easiest routes to get GMC registration. الBLAB exam in itself is not that difficult to pass. Okay, but with good preparation. Any exam, if you don't prepare for it well, you're not gonna pass it. But lab is a very manageable exam to pass. Okay. طيب بلاب 1 هو عبارة عن امتحان written. Exam tests your ability to apply your knowledge for the care of patients. It doesn't test how well you can remember and cite facts. Question relate to current best practice in the UK. This is the trick with BLAB 1 exams. يعني نحن بنكون الميديكال knowledge بتاعتنا ممتازة هناك في السودان وأي شيء، لكن البلاب 1 exam is mainly kind of UK evidence based. يعني دايرين best answer according مثلا للنايس guidelines وكده. فدي where you prepare well for the exam. You will need to answer the questions in relation to published evidence and not according to your local arrangements. هو exam mainly في الليفل بتاعت الفاونديشن trainee year 2 standard exam test. يعني you'll test your abilities. يعني إذا أنت واصل المرحلة بتاعت الفاونديشن trainee year 2 هنا في UK it will test your abilities as them. فهو ما امتحان ما صعب شديد. هو written exam 180 سؤال بيتحلوا على 3 ساعات. المين الحاجات اللي أنا بتذكرها من البلاب 1 exam أفتكر ما بلاب 1 exam I think back in 2017 or something. فهو التايم مانجمنت مهم جدا جدا مع بلاب 1. الكويستشنز لأنه بالبراكتس الكثير لما تشتغل على أسئلة كثيرة في الكويستشنز بانكس وكده لازم to time yourself إنه أنت مثلا تحل السؤال في 1 to 2 minutes maximum وتمشي للي بعديه. والسؤال عادة بيبدأ بسيناريو وبعدك بيقول لك اختار البيست answer. فهو mainly I think it's time management and well preparation. يعني زول يشتغل أسئلة كتير. طيب بالنسبة لبلاب 2 بلاب 2 هو OSCE exam, Objective Structure Clinical Exam or OSCE exam. It's made up of 16 stations or 16 scenarios, each lasting around 8 minutes and aims to reflect real life settings including a mock consultation or an acute ward. يعني بيخطوك في cubicle كده 8 minutes. ممكن من برا يكون عندك سيناريو وتخش to start أو السيناريو ممكن تلقاه جوا قدامك مع الاكزامينر مع actor and then you start the station. The exam, as I said earlier, covers everything a UK trained doctor might expect to see on the first day of foundation year 2. It tests your ability to apply knowledge of care of the patient, not how well you can remember and recite facts. This is important لأنه الامتحان بتاع البلاب 2 ما mainly إنه أنت والله عارف شنو في الطب ده عارف شنو في الميديسن. It's about how you deal with different situations. يخطوك مع angry patient, يخطوك مع overdose patient, يخطوك how you will deal with it. Okay? So ال ethical approach مهم فيه, communication skill مهمة فيه. So this is mainly about BLAB 2. All the questions relate to current best practice. You should answer them in relation to published evidence and not according to your local arrangements again. Okay? طيب دي بالنسبة لبلاب 1 and BLAB 2. Let's have a look if there's some questions that I can answer now. What are the requirements after the graduation directly, Jihad? In other words, what pathway we should go through. So this is what I'm talking about now. لما بدأت في GMC registration pathway بدأت لكم بالEnglish requirement, which is the English has to be done first. This is the first step. Second step, you look into the options of the GMC registration. لما قلت لكم pathways either through الBLAB, either through postgraduate qualifications, أو either sponsorship اللي هي حنجي نتكلم عنها briefly. ممكن امتحن البلاب بعد التخرج طوالي ولا لا؟ ممكن تمتحن ما في مشكلة, ممكن تمتحن as long as you pass the English test. بعد الامتياز عندك جاب كبير 7 سنين ما في مشكلة as long as you can explain it. They will ask you to explain. فيحكوها معاكوا أي شيء. لكن they will ask you to explain it. هي المين issue بالنسبة لهم الانترنشيب ده. الانترنشيب ده لو اتعمل perfectly ياخد 12 months ما في lots of gaps in between يا هل maximum 5 weeks وكده. I think anything after that can be managed. في ناس they can go for many reasons, maternity, you have children to take care of, you have your whatever reason, like lots of things can happen in life that make you not progress in your career at that step. فدي كلها حاجات you can explain. طيب MRCP versus BLAB. نجي للبوست-graduate qualifications هسه بعد شوية. What about change from BLAB? What طيب يا مازن, what about it? لأنه so far what we know إنه البلاب is still ongoing, still ماشي, ما فيه مشاكل. BLAB 1 and BLAB 2 are still available. We can't know what's going to happen in 2024 unless GMC publish more information. they are reassuring الcandidates إنه لسه الموضوع ده لحد 2024 وكده. فالناس تشتغل بالموجود حاليا. لأنه ما عندنا معلومات عن حاجة عن اليو كي ام ال اي. عندنا معلومات إنه حيبقى في يو كي ام ال اي 2024 لكن what's the details, how many exams, where it's going to be done, no one knows. طيب have a gap during my internship. How can I fix this problem? Depends on the gap. How long is the gap? You can only explain what's the reason of the gap. Is the GMC سألتك to explain what's the reason for the gap honestly. Whatever is happening at that time you need to explain it fully. عندك evidence even better. They will assess case by case. كويس. يعني no one can say anything about this. It's difficult because الGMC يعني هو زي ما قلت لك الأوفيسر بيمسك الكيس بعين. والله حاصل كده وده السي في بتاعك وده كده وانت في الفترة دي في الانترنشيب وقفت مثلا 2 أو 3. طيب we'll assess what's the reasons. If they accept the reasons then that's fine, your registration will go ahead. If they don't accept the reason they might ask for evidence, they must ask you to fill in some forms and things. يعني الحاجة الممكن في النهاية إنه ما يقبلوا full GMC registration, they offer you provisional GMC registration instead. طيب ال OIT ممكن يكون بعد البلاب والزول يجلس للبلاب بشهادة الإنجليزي. No. So as I said, first step, you have to clear your English language test. You have to. ممكن أبدأ الممبرشيب بعد كده أعمل اللغة وأسجل. يعني ممكن تبدأ الممبرشيب exams وبعد ذاك تمتحن اللغة وكده وبعد ذاك تجي تسجل للGMC. لكن لما تجي للGMC you have to يعني لازم يكون كل شيء جاهز. يكون عندك الفول ممبرشيب معها الإنجليش language exam. أوكي. لكن البلاب تحديداً عشان تقدروا تسجلوا للبلاب لازم يكون عندك يا OIT يا IELTS. لازم أصلاً دي أول حاجة بتدخلها في الأكاونت في الGMC أكاونت بتاعك. أو بعد ذاك they have to review it and accept it. بعد ذاك بيخلوك تحجز للامتحان. طيب المشكلة المقاعد جايين نتكلم عنها. تمام. Let's continue. We'll pick up more questions as we go on. طيب في شوية updates جديدة كان حصلت اللي هي في exemptions from the BLAB. كويس. There are 2 scenarios that can lead to exemption from BLAB اللي هي acceptable overseas registration exam أو relevant European qualification. حركز على الحتة بتاعت acceptable overseas registration exam. acceptable overseas registration exam الحصل شنو as of January من January 12, 2021. You may be exempt from BLAB if you have previously passed any of the following licensing exams. واحتمال تكونوا سمعتوا بها إنه أي زول pass يعني أو امتحن ال USMLE Step 1, Step 2 CK, Step 2 CS can apply for GMC registration. Okay. الناس اللي امتحنوا ال AMC اللي هو الامتحان بتاع ال Australian Medical Council الام سي كيو والكلينيكال اكزامينيشن، والناس اللي امتحنوا الكنديان الام سي سي كيو اي اللي هو بارت 1 and 2 in English لانه عندهم جزء بالفرنش. برضو they can apply for GMC registration. في شروط لكن إنه لازم USMLE التواريخ دي on or before 13th of March 2020 ما حاجة بعد كده، والAMC برضو on or before 5th of March 2020 والMCCQE برضو on or before 27th of October 2020. اوكي. والنمبر اوف attempts انه انت لازم تكون امتحنت اي زول امتحن الامتحان ده must have passed these exams in no more than 4 attempts. اوكي. ولازم برضه في شرط تاني خدتينه انه هو ما تكون حاولت البلاب you failed blab and then you tried for other exams. اوكي. so يعني هي كانت حاجة كويسة يعني الناس اللي كانوا امتحنوا USMLE for example, which is the most common. That's what I've heard. A lot of people امتحنوا USMLE first and then they're trying for the blab. Then they didn't need the blab because GMC has said like you can apply for GMC registration with your exams. فبس you have to follow the conditions that they've mentioned بالتواريخ وكده والnumber of attempts or no previous failed attempts. Okay. طيب acceptable postgraduate qualification اللي هو ده الروت الثاني لل GMC registration. Acceptable postgraduate qualification just in a simple one line sentence. It's Royal College full membership exams. كويس. أنا خدت لينك هنا للacceptable postgraduate qualifications. كلها listed fully في الجي ام سي اللي هم دايرين منك شنو بالضبط كده. ممكن نفتحها سوا هنا to share. I'm not sure if you can see it. I'm not sure if you can see it, but a link I can share the slides later on. اللي هو بوري كل membership exams. For example, if you want to talk about membership exams, الموضوع بياخد يعني ده this is I think needs a whole live or presentation on its own. اللي هي مثلا for MRCP you have to have MRCP part 1, part 2 plus the PACES, plus of course your English language requirement test, which is either IELTS or OET, and then you can apply for full GMC registration with these. MRCS, for example, MRCS part 1 and part 2 plus an English exam, and then you can apply for full GMC registration. Obviously, you have to have met the requirements for the internship وكده وما في gaps والكلام اللي تكلمنا عنه قبل. So let's look at some questions. قلت لي ما في صوت؟ قادرين تسمعوني مش كده؟ طيب, I'm looking through the questions. If I missed any question, I'm going to come back and reply to them, okay? If I'm planning to do my master's in the UK, Hannah, will it be doable to do blabs as well at the same time? Yes, it is doable. You can manage to do the blab exams in the same time, okay? It will take more effort. You're doing a master's, you're going to be studying all the time, but you can do it. طيب, آخر مقاعد لبلاب 1 حتعلن في شهر 11 لسنة 2023. I'm not sure about this statement. ما متأكدة. بالنسبة للمقاعد قفلت صحيح في 2023. The only way that you can know is أي زول عنده GMC account already eligible للبلاب, مثلا بدأ بالبلاب يعني بيقدر يحجز للبلاب, بتقدر تشوف available seats in front of you. As far as I heard, seats in August 2023 ونوفمبر 2023 are still available, لكن I cannot know for sure لأنه أنا الأكاونت بتاعي خلاص ما أنا already done blab 1 and blab 2, so I can't see seats, available seats. How can I prepare for the exams? What are the resources that I can study from? Or are there any online courses? طيب بالنسبة للبلاب 1 exam اللي هي في lots of questions banks around. عندكم ناس past test عندهم part كده للبلاب 1. في Blabbable if you heard about it before. Blabbable question banks. So my way of studying for exams is going through questions bank. A literature is always good. يعني you can always read a book or you can always read online about a specific illness or something. لكن لما تكون الحاجة question related، يعني مثلا لقيت السؤال ده جا والله في Blabbable or في one of the questions bank، مشيت بعدك فمش أفتش إنه ليه الإجابة دي كده أو الclarification بيكون أحسن. When you go through it system by system, it will help a lot to understand the whole system. يعني لو جاكم السؤال بأي طريقة بتحلوه. طيب after full GMC registration from where can I start in UK? إذا أخذتي full GMC registration يا ملاز you can start as هي بنسميها trust grade job or a service job. And an option is yours. You can start at a training job or you can start as a trust grade job. My personal advice is to start as a trust grade job first. A trust grade job اللي هي شنو يعني service job كويس، اللي هي دي ممكن تكون F1 level، ممكن تكون F2 level، ممكن تكون CT1 level، CTST1 level. Depends on your years of experience. Depends on the job اللي انت قدمتي لها. Depends on the job يعني اللي هي job description. Which level is it? Okay. ممكن كثير قاعد تحصل مثلا الواحد يخش انترفيو وبعدك يقوموا they offer you مثلا الجوب دي على F1 level مثلا. They like you, they want you to work, but they want you to start at a lower level. That's fine. If you are happy with that, you can start at F1 level. You can start at F2 level. Usually نحن كلنا يعني I think I started at F2 ST1 level service job. طيب any other questions? تمام كويس إن الصوت واضح. تمام. أهلا يا آمنة كيفك؟ والله بالأكتر. For registration I can do it by MRCS part 1 بس ولا لازم يكون معاها MRCS part B؟ لأني ما عايزة امتحن البلاب. طيب if you want to go through الفول GMC full membership exams بالنسبة لل MRCS it has to be the two part MRCS part 1 and part 2 plus الإنجليش عشان to apply for full GMC registration. في اللي هي في MTI route ممكن هنهبشه كده بفوق كده اللي هو ده للناس اللي عندهم مثلا English plus part 1. والMTI route ده اللي هو الناس بتجي على different visa اللي هي tier 5 visa for 2 years mainly. وبعد ذاك you can switch to another visa. فبنجي نهبش الموضوع ده بعد شوي. Do you need to do 1 year of internship before sitting for the BLAB exam? If it has been several years since graduating, not a new graduate. So yeah, Sheza, you are not a new graduate. You've not done your internship at all. So there is a huge gap between the year of graduation and doing your internship. Okay. كل هذه حاجات you can still go for the BLAB exams. لكن you will be asked at the GMC registration process لما تيجي تقدمي للapplication بتاع GMC registration they will ask questions ليه وأسبابك if you have evidence that would be great. أهلا يا وضاح شكرا لك. طيب تاني في أسئلة؟ نواصل شوية وبعدك بشوف if I can pick up more questions. okay? طيب نجي لنقطة بتاعت السبونسرشيب اللي هي دي one of the pathways for GMC registration. هي ما pathway معقدة لكن it is one of the routes that to get GMC registration without finishing the full exams. طيب كيف؟ فيها two routes. most common واللي بنعرفه كلنا أو بكونوا سمعتوا به Medical Training Initiative, which is the MTI route. This program allows doctors to work in the UK for a maximum of 2 years on Tier 5 visa, after which they must return home. You can always return to UK on a different visa. تمام؟ MTI route ده يعني it's known اللي هو الناس اللي بيكون مثلا عندها part 1 وإنجلش وعندهم مثلا شغالين training في السودان أو عندهم good experience, عندهم good years of experience وكده, they can apply for the MTI route. If they get accepted, المستشفى ذاته sponsor them through the GMC registration. كويس؟ يعني بديكم الفول GMC registration because you are going to be working for them for 2 years. Kind of to do that. يعني زي كانها شنو؟ قريبة لفكرة fellowship for 2 years. اوكي؟ بس ال one downside بتاعها انه انت بتكون على different visa اللي هي tier 5 visa. التير 5 فيزا دي ما زي التير 2 فيزا اللي هي نحن بنجيبها الدكاتره بيجيبوها اللي هي recently changed to health and care visa. فالتير 5 فيزا دي ما محسوبه في ال indefinite leave to remain clock. انا ما اقدر اخش كثير في الديتيلز بتاعت الفيز هسي لانه عندنا لايف عليها بعدين, لكن يعني السنتين اللي حتقضيهم على تير 5 ما حتكون محسوبه في ال5 سنه towards الاقامه الدائمه في UK. بس دي المين ايديا. تمام؟ في other route اللي هي some hospitals here in UK provide sponsorship for GMC registration. This may allow you to be registered without sitting lab or having an acceptable يعني full acceptable postgraduate qualification. أخذت لكم لينك هنا في البرزنتيشن ده applying for registration using sponsorship. هي خدين الجي ام سي خدت لسته عديل للمستشفيات اللي بتعمل الحاجه دي. كويس؟ هي لكن depends on many factors انك انت تكون عامل مثلا at least part 1 and part 2 في ال Royal College exam for most common اللي هي most popular لل MRCP وكده. بتكون عاملهم الاثنين plus already في English you meet the English requirements. And then they can sponsor you to come and work for them, and then they sponsor you through the GMC registration. They can get you full GMC registration. المستشفيات لستة كاملة. If you click on the link, it will take you directly للمستشفيات they offer this, where they offer this exactly. كويس؟ فيها 2 department وكده. Doctors applying through sponsorship are required to demonstrate their English language skills by achieving the current minimum scores in the academic version of IELTS or OET زي ما قلنا. تمام؟ فيها الصفحة دي فيها كل الديتيلز عن الموضوع ده. الموضوع ده ما easy وما صعب, لكن هي مستشفيات معينة جدا يعني هي اللي بتعمل الحاجة دي وبتعملها في programs معينة. اوكي؟ فlook into the list and see يعني if you can fit into any, لكن هي بس one of the routes for GMC registration. موجودة مكتوبة قاعدة في يعني قاعدة في GMC website و all the information is there. لكن it's just a bit of a unique pathway to go through to get a job. يعني هي mainly إنه بيوظفوك تشتغل في department معين and then they will sponsor you to get GMC registration. okay? قريب لفكرة ال MTI, لكن زي كأنه independent, المستشفى براه بيشتغل الحاجة دي rather than a full program. طيب نجي لنقطة الديليز والديليز والناس كلها بتشكي everywhere from delays. البلاب 1 ناس ما لاقي exams, ناس waiting for 6 months a year to get a BLAB 1 seat, ناس ما قادرة تسجل فترة كانت للOET والIELTS. delays. المين point الديليز دي is it in your hands? It's not in your hands. COVID ضربت أخرت كل شيء في العالم, كل شيء affected everything. أي شيء from the smallest services لأي service، أي شيء impacted. فالديلايز دي حاجة in every sector. We're seeing it in every sectors. هل السيتويشن improving? Yes, it is improving. هل ال GMC are trying to catch up? Yes, they are trying to catch up very hard. They are trying to offer seats. الباكلوج، الديليز، الكانسليشنز اللي حصلت كلها during الكوفيد. They are saying that mostly they are trying to clear up أو حسب ما سمعت they cleared up most of the backlog اللي كان due to cancellations during الكوفيد. في more seats now available. صح صعبة، أنا يعني بسمع إنه السيتس بتروح within 5 minutes or something من إنها تنزل، لكن still people are getting lab 1 seats, lab 2 seats and so on. فبس دي من بس أنا أذكر الناس إن الحياة دي حاجة دي مرات تكون out of your hand. So if it's out of your hand, do I stop and continue just looking at it؟ يعني أنا ما لقيت lab 1 خلاص أقعد أعاين كده يا ربي أنا أعمل شنو بس أنتظر. There is you can have like maybe 6 months delay, 1 year delay. You can do other things. There are other routes to get GMC registration. Is a Royal College exams are available and you can prepare for it. Go for it. Go for your يعني الحاجة اللي انتم مهتمين بها لو MRCP, MRCS في available exam in front of you. Go for it. There are other options that you can consider if البلاب 1 ما أي صح البلاب سهل أسهل من ال other routes. لكن if it's not available because of the delays, don't just stick on that plan. There's always plan B, plan C, plan D. This is what I'm attaching the next photo اللي هي if plan A didn't work, you have the whole alphabetic letters to look into. يعني there is lots of things that you can think about and you can do. كويس. فالناس ما تحصر روحها أي صح في delays أنا ما لاقي seat. I'll think about what's the next step. What can I do rather than what I can do. This is out of your hand. Okay. طيب تمام. خلينا نرجع نشوف إذا في أسئلة. اللي هو البرنامج طبعا هي يعني أنا عملت بس just a touch base on everything يعني with the GMC registration with the GMC registration, how to get GMC registration, how to come to UK وكذا. فالموضوع كبير متشعب و I hope I have touched on every aspect and just kind of explain how to get GMC registration through different pathways. I will look into your questions because that's what we are trying to mainly achieve, to answer as many questions as we can. طيب خلينا نشوف إذا في questions. Okay, Khawla, how much approximately I should pay for the training for specialty in UK? وهل بيدفعوا لي راتب في سنين التدريب؟ Yes, yeah, definitely you are paid here for it. You won't do anything for free here in UK. You have to be paid. I'll pay standardized. You can look it up according to the specialty. For example, for GP training or for something else, you can look it up. ST1 level, ST2 level pay كده كلها available. فهي بيدفعوا لك راتب في سنين التدريب دي. تكلمي لنا عن ال MRCP Part 3 الفرص بتاعته كيف؟ You mean the PACES exams? Okay, I'm not the best to talk about this. I think ممكن نشوف الشباب من السجدة team or anyone else who has the knowledge about the PACES exam and everything, and how if you can help Rehan with this question. Okay. طيب. المطلوب شنو السبونسرشيب؟ ادخلي اللينك اللي انا رسلته مكتوب في الموقع نفسه. mainly الايديا اللي هي يكون عندك English language test plus at least يعني minimum. For example, if you are going through MRCP route يكون عندك MRCP part 1 and part 2. If you're going through MRCS route مثلا يكون زول عنده MRCS part 1 or something. هي different from hospital to hospital. يعني زي كأنه الهوسبيتال بيمسك الناس اللي هو محتاجهم. مثلا زول عنده 13 years of experience in a very much needed specialty، دايرين دكاترة في السبيشاليتي دي، والمستشفى عنده license to sponsor international medical graduates or overseas doctors to get them through the GMC registration, so they can do that for you. هم بيكون عندهم تواصل مع ال GMC و they can arrange for this for you. طيب تاني في سؤال. My question about the ID check. Yes, so during the COVID, the ID checks كانت وقفت، أو كانوا خلاص they are accepting everyone whatever proof of evidence, proof of ID they provided, for example in BLAP 2 or كده، اعتبروها دي ID check. لكن هسي رجعوا الرول تاني as far as I've read on the GMC website، رجعوا الرول تاني when you have to go for an ID check appointment. Is getting a service job nowadays become more difficult? I saw colleagues with GMC registration and still waiting. Service jobs are available. There is difficulties when how you present yourself on the CV, how you present yourself في ال NHS application website. مثلا أنا مقدمة الجوب الفلانية دي. You have to personalize an application, you have to change an application, you have to know how to sell yourself for that job. كويس. This is number one mistake that I notice why people are not getting picked up for jobs despite huge shortage of doctors in UK. Situation اتغير. It is getting better. A shortage is getting better, لكن still they are still in dire need of more doctors. Definitely there are jobs out there. You just need to know how to improve your CV, how to add more to your CV, and know how to sell yourself for the job. Is there any time limit for GMC registration via MRCS? I'm not sure what do you mean by time limit. Can you explain? Do you know about anesthesia exams? No, not really, but you can always look it up, and I hope other people can help who went through anesthesia exams, okay? If I cleared my English test but have not finished the internship yet, and I live in UK, would I still be able to get any job with the provisional registration? If you live in UK and you have provisional registration and you have not finished an internship in any country, you can go through a foundation program. You can apply for a UK FBO foundation program. What if one finished MD in Sudan? In which year can join training? بالنسبة للMD بتاعت السودان, training in Sudan, it's good that you've done it. You've been trained in a certain specialty. That's amazing in Sudan. بالنسبة لإنه UK تقبلك directly على training job in the same specialty, it depends, and it's very very competitive. UK التريننج بتاعها فيه many aspects غير الشغل بتاع المستشفى. There's portfolio updates. You have to keep up with the portfolio. You have to keep up with the work-based assessments. You have to keep up with the exams and everything. So I can't say that if you finished training in UK, you won't jump in immediately to a training post in UK. Especially if you are aiming for higher level training posts like ST3, ST4 and something. It's different. It's an application. في application عادي الواحد بيقدم وكده. فيه لستة كاملة for requirements. What do you need for it? غير الإكزامز، غير البورتفوليو، غير الأوديتس، غير presentations. فيه lots of things. فالسؤال a bit generalized، لكن لما نجي نعاين له in details, it's a different process. You have to look into what is the training that you are aiming to join, what is the requirements, and what level do you want to join, and what are the requirements for that level. طيب هذا وضاح كتب لكم كلام عن السبونسرشيب. شكرا يا وضاح. قال لكم for direct sponsorship you need master or MD or incomplete membership, MRCP or MRCS first part in the specialty, English exam, و years of experience in the specialty will be preferable. تمام. بالنسبة MRCPI أنا بالنسبة لي الحتة دي a bit of a gray area. I hope such the team members, if anyone available and knows about MRCPI, the pathway for registration with it, hopefully they will come in to help. تمام. Any further questions? Hopefully I've managed to answer most of the questions here. تمام. شكرا يا مهند. هذا قال لك MRCPI is now acceptable for GMC registration. You just need English language test with it. تمام. 100. طيب, can I help with anything else? Any further questions? Emphasize a bit more on the clinical gaps. طيب, الclinical gaps, خلينا بس to stop live هنا sharing 1 second. Okay. بالنسبة للclinical gaps, the most important clinical gap اللي هو during internship year. ده بسميه يعني الكلينيكال جاب الخطر. يعني مش خطر من انه يعني الGMC لا حترفض الريجستريشن كومبليتلي وكده طوالي وهنا، لا، اتس كيس باي كيس. لكن بيحكوا فيه شديد، يعني بيسألوا أسئلة كثيرة. إذا كان عندك gap of more، كان عندك gap عندك أو عندك gap more than 5 weeks in the internship, you will have to explain. This is the first step. You will have to explain. بيسألك طوالي ليه. الابليكيشن ذاته ما بخليك يعني to go through الستبس. يعني لو خطيتي مثلا الشيفت الأول بعد ذاك عندك whatever 2 months you'll have to explain it. كويس. الزول الأوفيسر اللي بيمسك الابليكيشن هيعاين الابليكيشن will assess and will see if this is an acceptable reason for them or if they need further evidence. Sometimes they will ask you for further evidence to fill in forms or something. Sometimes they might say, you know what, no, we'll send you to the registrar to review the application كله. It can get a bit difficult, can drag along, asking for lots of evidence, lots of explanations, lots of statements. لكن بعرف ناس كتار عندهم gaps during an internship. More than the 5 weeks, they explained it, they went through a process, and then they got their full GMC registration at the end. ما كلنا human being. يعني how can you protect yourself from not having a gap during internship if you must. يعني إذا كان لازم تاخد gap during internship for whatever reason, you can't help it. So you have to explain evidence يكون قاعد، و hopefully things will go through. في الناس تواصل في البلان بتاعتها وتمتحن امتحاناتها، ولما يجي وقت GMC registration it will be a case by case. So الأوفيسر الماسك الكيس بتاعتك أو بتاعتك will look into all of the evidence, what happened وكده. طيب, please need to know more about portfolio. We can talk about it in another live because portfolio is يعني اللي هو لما تيجي تشتغل في UK service job or a training job, it's good to in the service job ما mandatory, لكن it's good to keep a portfolio لأنه it will help you gather evidence about your competencies and capabilities and everything. It's good to keep a portfolio even if you are on a service job. If you are on a training job, it's a must. واللي هي بيدخلوا فيه كمية من اللوج entries, evidence, work-based assessment, evidence of attending teaching, حاجات زي دي. فالموضوع ده يطول شرحه يعني عن البورتفوليو. Just this is a general idea about the portfolio. If I finished the full membership a long time ago, can I still register? You can still register. Full membership exam plus English. If you have both, then you can apply for registration. Can you talk in brief if I have FRC Path Part 1? Can I join sponsorship? As I said, with the sponsorship pathway, هي لستة من المستشفيات. حتى الجي ام سي كاتبين في الويب سايت. If you want more details, you have to contact the hospitals دي. You go through the hospitals مثلا providing a job في your specialty. So you contact them and see. They will assess your CV and things. Okay. Are the seats for BLAB 1 more available in UK compared to other countries, or there is no difference? So BLAB 1 seats are available in UK and other countries. A number of seats exactly, I'm not sure about. I think it should be the same all around. لكن يعني هي بيحسبوها بطريقة معينة كده ناس الجي ام سي. There are seats available for BLAB 1 in UK and overseas. Depends where you want to take your test. طيب, MTI pathway for registration. I think we should do a full live on MTI pathway. لأنه it's a different topic. It's a whole new topic on its own. I've just touched based on it لأنه it's one of the routes that you can get GMC registration. We'll arrange for something. We'll put it in the notes and we'll arrange for something for it, a live to talk about it in details. طيب, do I need permanent registration from Sudan after BLAB, or only internship completion certificate is enough for full GMC? في requirements للجي ام سي registration لما تيجي تقدم الورق للجي ام سي registration بيطلبوا منك اللي هو شهادة الامتياز والشهادة الكرتونية للجامعة وكده. Not that is needed. The permanent registration itself ما بيسألوا منها يشوفوها. لكن لما زول يجي يكتب اللي هو في الجي ام سي registration application تكتب الستبس بتاعت اللي هو الاكسبيرينس بتاعتك since graduation. فمفروض في one point تكتبي مثلا انه هنا في الفتره دي اخذت البروفيجنال ريجستريشن بتاع السودان مثلا, والفتره وبعديها اخذت الفول ريجستريشن. It will show يعني a pattern of continuity, يعني انه الزول ده ما اشتغل الا لما اخذ الفول سودان ريجستريشن يعني. Can you talk about EPIC verification? What do you want to know about EPIC verification exactly? The main document المطلوب for EPIC verification if you are going through the BLAB pathway اللي هي الشهادة الكرتونية بتاعت الجامعة. الشهادة الكرتونية specifically, ما أي شهادة تانية يعني, it has to be الشهادة الكرتونية اللي هي تتحمل على الموقع بتاع الإبك. الموقع بتاع الإبك ذاته في البداية بيسألك من ID verification وكده, your name, your details, صورة من الجواز, and then they verify your ID through camera, notary cam application. بعد ذاك بتعمل داونلود للشهادة الكرتونية, and then they will verify it. جامعات كثيرة في السودان بدأت to verify this online, يعني طوالي الفيريفيكيشن بيحصل, لكن في جامعات لسه اللي هي اللي ترسل الإبك يرسل لهم بالبريد ولسه يردوا, ف it takes a bit of time, sometimes up to 8 weeks, 3 months, depends on the university, يعني it depends على الجامعة بتاعتك. ف check with your check مع الجامعة بتاعتك. طيب what else what about the gap between the year of graduation and internship? General rule is not a problem. كلنا كان عندنا gap between ال year of graduation لحد ال internship. For example, for myself, I think I remember it was 9 months or something. فبنكتب بس في الفترة دي إنه نحن we're applying for a provisional registration or awaiting an allocation for the internship rotations. It was accepted. They didn't ask questions. They might ask if it kind of بقت أكتر من سنة ولا حاجة. They might ask about it. حتى لو سألوا الواحد كان explain يعني it's out of our hands. معروف الانترنشيب التوزيع للامتياز في السودان بياخد زمن. Can I do EPICS for UK without yes. الإبكس process مختلفة. ممكن الواحد يبدأها من البداية عشان بتاخد زمن sometimes depends على الجامعة بتاعتك. ف you can definitely start الإبك process. تدفع رسوم بتعمل داونلود للشهادة وفي هم متطلبات زي ما قلت بتاعت الاي دي verification in the beginning بالجواز وبالبتاع وكده وبعدك تعمل epic verification للشهادة بتاعت الجامعة. اوكي طيب يا جماعة I'll see if there is I want to do full membership of MRCS then how can I register for surgical training job in UK and how can I get what's requirement then do I need GMC registration if إذا عملت إذا يا وضع عملت الفول membership ال MRCS membership to register for a surgical training job you mean to apply for a surgical training job اللي هو you have to fulfill the requirements for a training job اللي هي for a surgical training job okay فدي موجودة في ويب سايتس through الأوريال بتوريك ال requirements أو أوريال ويب سايت بوريك ال requirements بتاعت surgical training اللي هو على lower level وعلى ال ST3 level what do you need for it usually الناس one of الناس اللي بيكونوا دايرين يعني to go into training from outside UK I would advise not to go into training directly just because it takes a bit of time to get used to the system وانت لما تيجي تبدأ الجوب هنا as a training job you are expected to function at a level above F2 trainee okay so you are expected to handle sick patients to know how to care for the ward to know how to answer bleeps وكده ف that's why I always advise إنه أحسن الناس تبدأ على service job to get used to the system more easily لأنه في service job you can ask them والله ادوني induction period ادوني زمن اتعود off on calls in the beginning و they can support you massively يعني as a trust grade لكن لما تكون يعني as a trust grade or service job لما تكون trainee صعب جدا to accommodate these things you are expected to function at a certain level or if you didn't then the issues will arise and they will start asking questions and they will review everything and you start having meetings and it's going to be very stressful so that's why I advise like people to go for a non-training job first. Which is best routes? I can't for fresh graduates, for fresh graduate students. I can't say there is a best route. I can say that the only statement I can say is BLAB exams compared to Royal College exams is easier. لكن هل is it easier to get it now with the BLAB seats والتأخيرات والdelays? It's very difficult. It's becoming difficult. So you might think about other options. Here, if you have Royal College exams available for you and you can go for it, it will save some time. Please, is it okay to create a GMC account before 1 month of booking a seat for BLAB exam, or I need more for it? A GMC account, you can create it anytime. It's just an account. They will ask you a few questions and everything. So you can create a GMC account at any time. You answer all of the questions asked and you can create a GMC account. لكن عشان تبوك البلاب exam لازم الايفيدنس بتاع الانجليش يكون جاهز اللي هو الاو اي تي والايلتس و submit it to them. بعد ما submit it to them, then they will allow you to book for BLAB 1 exam. Is it easy to get a service job without post-internship experience? I have a relatively good CV. I would say yes, you can get a service job at different levels, F1 levels, F2 levels. You can get a service job. Okay. For BLAB 2, how can I apply for the visa? يلا موضوع الفيز والحياة دي, we'll come and talk about it in another live. We are arranging to talk about visas and اللي هي health and care visa. We'll talk also briefly about BLAB 2 visa, or here visit visa in general. Okay. تمام يا جماعة. I think we have like more than 1 hour so far. I hope this live was helpful and شكرا لكل الحضور. وإذا عندكم أي أسئلة keep adding your questions. I will try to answer them. عايزة أشجع الناس إنه to add their questions on the post. كويس؟ لأنه it will help other people. بيجوا ناس ثانيين بيكونوا دايرين يسألوا نفس السؤال, بيراجعوا البوست بيلقوا الأسئلة. It will help them a lot. كويس? Rather than sending individually, like, and I'm happy and for people to send me PMs or anything if there's any specific thing that I can help with. لكن I encourage you all والله إنه تحطوا الأسئلة هنا. It will help a lot of people. الأسئلة بتتكرر كتير, ولما تكون قاعدة الناس دي كلها بتستفيد. ف look at الفائدة العامة برضو. And what's your question? I think I've missed it. Can you retype it, please? Is there an annual fee for being a member in the GMC, Khawla? Fee annual fee. I mean, if I had full registration of GMC and didn't find job easily, yes, you still have to pay the fees. You still have to pay the annual fees. Okay. طيب يا جماعة, شكرا لكم شديد, شكرا للحضور, وأي أسئلة خدتوها في البوست we'll keep answering. كل التيم قاعد, كل سجد التيم قاعدين. We can answer the questions. وإن شاء الله في سلسلة بتاعت لايفات جاية. We'll arrange to talk about more things in more details. And I hope this live was helpful. شكرا لكم كثير, إن شاء الله ربنا يوفقكم في طريقكم. وزي ما ذكرتكم قبل, الحاجات ال out of your hand, you look at plan B ما available, plan C ما available, plan D, you just go on. Okay, don't stop. تمام, يلا السلام عليكم.